Depression is a common mental health condition marked by persistent sadness and changes in thinking, sleeping, eating, and behavior. It manifests in various forms, but the good news is that it is treatable, often through talk therapy, medication, or a combination of both. Seeking medical assistance promptly upon noticing symptoms is essential for effective management and recovery. It's normal to feel sad or grieve during tough life events, such as losing a job or going through a divorce. However, depression is different. It persists nearly every day for at least 2 weeks and involves additional symptoms beyond just sadness. Depression is the most commonly diagnosed mental health condition, encompassing various diagnoses and manifesting in diverse forms. Each type affects individuals differently, leading to multiple classifications. With this in mind, let's explore some of the most common types of depression. Number 1. Major Depressive Disorder, MDD, also known as clinical depression. Major Depressive Disorder, MDD, or clinical depression, is characterized by persistent low moods, diminished interest in enjoyable activities, and lack of motivation for daily tasks. According to the American Psychological Association, APA, MDD is the most common form of depression, often the condition individuals refer to when diagnosed with depression. Common symptoms include ongoing low energy, even after sufficient sleep, difficulty concentrating and making decisions, loss of interest in activities once enjoyed, recurring thoughts of death or suicide, significant weight loss or gain. For a diagnosis of MDD, these symptoms must persist for at least 2 weeks. Number 2. Persistent Depressive Disorder, PDD, also known as dysthymia. Persistent depressive disorder is akin to major depressive disorder, but is characterized by its long-lasting nature. The symptoms of PDD mirror those of major depression, though they are often fewer and less intense. Common symptoms include a low mood nearly every day, reduced interest in activities once enjoyed, significant weight or appetite changes, insomnia or excessive sleep almost daily. For a diagnosis of PDD, these symptoms must last for at least 2 years. Number 3. Bipolar disorder. Bipolar disorder is a group of mood disorders defined by alternating episodes of mania and depression. The DSM-V classifies it into 4 types. 1. Bipolar I disorder involves fluctuations between manic and major depressive episodes, or a mix of both. 2. Bipolar II disorder features cycles between major depressive episodes and less intense manic episodes, hypomania. 3. Cyclothymic disorder involves periods of milder depressive episodes and hypomania. 4. Other specified and unspecified bipolar disorders includes forms that don't fit the other categories. The unpredictable mood swings in bipolar disorder can lead to mixed episodes, where symptoms of both mania and depression occur simultaneously. These episodes can last for weeks, months, or even years. Symptoms of mania. The highs may include excessive happiness, hopefulness, or excitement. Number 4. Seasonal Affective Disorder, SAD. Seasonal Affective Disorder, SAD, commonly known as the winter blues, features predictable episodes of major depression or mania during specific times of the year, usually in fall or winter, though some may experience it in spring or summer. Common symptoms include increased sleep, feelings of sadness, irritability, or hopelessness, low energy, increased appetite. Recognizing these symptoms is essential for seeking appropriate treatment and support. Number 5. Postpartum depression. Commonly known as the baby blues, postpartum depression is a depressive episode that can affect some women within 4 weeks to 6 months after childbirth. According to the Mayo Clinic, signs and symptoms of postpartum depression may include symptoms of postpartum depression: depressed mood or severe mood swings, difficulty bonding with the baby, changes in appetite, sleep disturbances, feelings of worthlessness. Recognizing these symptoms is crucial for seeking help and support during this challenging time. Number 6. Premenstrual Dysphoric Disorder, PMDD. Premenstrual dysphoric disorder is a serious condition that affects some women, typically beginning the week before menstruation and subsiding within the first few days of their period. The symptoms must be severe enough to disrupt social activities, work, and relationships. Common symptoms of PMDD include irritability or anger, sadness or despair, suicidal thoughts, mood swings. Number 7. Atypical depression. Atypical depression is a type of major depressive episode that features characteristics not commonly found in other forms of depression. One of the most notable traits is that a person's depressed mood significantly improves in response to positive news. Individuals with atypical depression may experience the following symptoms: persistent sadness, loss of interest, weight changes. Number 8. Psychotic depression. Psychotic depression is a subtype of major depression featuring severe depressive symptoms alongside psychosis. This can include hallucinations, perceiving things that aren't present, or delusions, which are false beliefs and a disconnection from reality. The combination of these symptoms significantly impacts daily functioning and overall well-being. Common symptoms of psychotic depression include agitation, anxiety, hypochondria. Number 9. Situational depression and its symptoms. Situational depression, or reactive depression, is a temporary condition triggered by a traumatic event. Unlike major depressive disorder, which can occur without a clear cause, situational depression is linked to specific incidents such as job loss, breakups, financial issues, or bereavement. While it shares symptoms with major depression, situational depression is typically less severe and shorter in duration. However, it can still impact daily functioning and emotional well-being. Common symptoms include sadness or hopelessness, loss of interest, difficulty concentrating, fatigue or low energy. Number 10. Disruptive mood dysregulation disorder, DMDD. Disruptive mood dysregulation disorder, DMDD, is a childhood condition characterized by severe chronic irritability and intense temper outbursts that are disproportionate to the situation. It is diagnosed in children aged 6 to 18, with symptoms beginning before age 10. Introduced in the DSM-5, DMDD addresses chronic mood dysregulation that doesn't fit other mood disorders like bipolar disorder. Children with DMDD experience daily extreme irritability, resulting in significant disruptions in their home, school, and social lives, reflecting consistent patterns rather than occasional tantrums. Key symptoms of DMDD: severe temper outbursts, chronic irritability, outbursts in multiple settings. Number 11. Double depression. It is a condition where an individual suffers from both persistent depressive disorder, PDD, also known as dysthymia, and periodic episodes of major depressive disorder, MDD. Those with double depression experience a prolonged low-level depression, PDD, that is occasionally interrupted by more severe and intense depressive episodes, MDD. Common symptoms include ongoing sadness, low energy, difficulty concentrating, feelings of hopelessness, and episodes of deeper depression that worsen these symptoms. The combination of chronic and acute depression makes double depression particularly difficult to manage. Number 12. Treatment-resistant depression, TRD. It refers to a form of depression that doesn't respond adequately to standard treatments like antidepressant medications or therapy. People with TRD may continue to experience significant symptoms even after trying multiple treatments or combinations of treatments over a prolonged period. This condition can be frustrating and emotionally draining, as it often requires more complex approaches to treatment. Symptoms of treatment-resistant depression: persistent sadness, low energy, sleep disturbances, difficulty concentrating. Number 13. Substance-induced depression. It occurs due to the use of drugs, alcohol, or certain medications and toxins. It can arise during active use or withdrawal, with symptoms potentially lingering after the substance is cleared from the system. Diagnosis can be challenging as the depression is directly tied to substance effects rather than an underlying mood disorder. Symptoms of substance-induced depression: depressed mood, fatigue, loss of interest. Substance-induced depression can be managed through detoxification, rehabilitation programs, therapy, and possibly medications to stabilize mood during recovery. If you're familiar with the various types of depression, it's essential to acknowledge that any form can be difficult to manage. If you're experiencing struggles, please consider reaching out to a qualified mental health professional. Finding the right support can be instrumental in helping you regain control of your life. Don't forget to like this video And make sure to subscribe and turn on notifications so you won't miss any of our uploads. Thank you so much for watching, and stay tuned for the next video.